So when a doctor is going to prescribe medicines, the first thought is this medication actually indicated? And assuming that you've decided in your mind that this medication is the right choice for your patient, then you have a checklist. You start with what medication is the safest and least and most likely to have the fewest number of side effects. Typically we'll start with what traditionally was considered a weaker opiate. We have medications such as tramadol, which tend to have fewer side effects than the more traditional Schedule II opiate medications. Tramadol is now a scheduled medication, but it's not scheduled in the same way that an oxycodone or a hydromorphone would be scheduled. And the nice thing about tramadol is it tends to have fewer side effects as opposed to one of the older medications in the opiate class. So when it comes to prescribing pain medications, there are certain guidelines that are very important, and what we've realized, if you look back over the last 10-15 years, is what's considered standard of care has really changed in a dramatic fashion. At this point, documentation, not that documentation was ever unimportant, but documentation is key. Other changes that we've seen over the last 5 to 10 years is urine testing. Looking for the drugs in the urine is now standard of care. And we're much more acutely aware of the need for documentation of findings that match the need for the use of the medication, or additional testing looking for the diagnosis to confirm the diagnosis for which you're prescribing the medication.